Yeah, everyone is in waiting room. See, add.
Good evening, sir.
Good evening, all. A warm good evening for all the participants in Zoom and also uh, Fitness and Rehab India YouTube viewers, especially PGET aspirants. So today we are having our resource person, Dr. Arun Balasubramaniam, sir. We are already late by 8 minutes. So I welcome him and I request Dr. Arun, sir, to start the session. Please, sir.
Thank you, sir. Yes, sir. Is it visible, sir?
Yes, sir.
Shall we start, sir?
Yes, sir. Please, sir.
Yeah. So, thank you for the wonderful introduction, Mr. Chandra. Good evening, friends, and we are back to the class of multiple choice question, and we are here for the class number 5. So, as discussed today, last classes, and I have told that we are going to see about exercise therapy in today's session. So, the same rules and regulations. Kindly type your answers as the question follows in the chat box for the questions, as well as I have few photographs. You have to find out what is the photograph, and I will give a small clue to today's session. It's very easy. All the photographs are the derived questions which you studied in your exercise therapy. Right? We move into the class today. Right, our first question. During relaxation technique, all the features are true about support, right? So in the relaxation techniques, all the features given below are true about the support, except one. Is it soft head pillow or a small pillow under hamstrings or a feet held in mid position or sagging beds? So soft head pillow or small pillow in the hamstrings or feet in held in. Yeah, so everyone has put a right answer. It is sagging bed. Why it is sagging bed? Because when you have not have a strong bed or the hard bed, you are prone to have a abnormal spinal problem or abnormal spinal posture, which results in chance of getting lower back pain. So we have to advise the patient comes to you. You have to advise the patient that don't use a sagging bed, use a strong bed, and also advise that do not lie on the tape cord or the thread cord, which is usually seen in the village side. So that has to be avoided, which are one of the predominant cause for the low back pain. So if a patient comes here, advise them how they are lying down. That has to be the important question. Right. We'll move on to question number 2. During application of passive movements, when the limb is heavy, right? When the limb is heavy, how physiotherapy supports the limb? So when you apply passive movements and you are when you find that the patient is obese or larger patient, what you are supposed to do? So whether you are using other physiotherapist has to hold both the limb, hold both the hand using the limb, or use another physiotherapist to hold the limb. Use axial suspension to hold the limb or use the patient's hand to support the limb. Just you are typing. Very good. I think everyone has put the right answers here, right? So the right answer is use axial suspension to hold the limb. Since when we are in the department, a single therapist, we are not able to catch hold of another therapist to help for the passive movements. So ultimately, you have to use some axial suspension to hold the limb and start doing the passive movements, right? If it is in the department, whereas if the patient was in the ICU, then you are supposed to do someone's help to do the movements. Right, question number 3. It is about relaxation and the breathing exercises. During pump handle movements, the movement of vertebrosternal ribs from dash actors. Which of the vertebral ribs produces movement? Is it 1 to 4 ribs, 3 to 9 ribs, 2 to 6 ribs, or 4 to 10 ribs? Which vertebrae produced in the vertebrosternal vertebra which produces the pump handle movement. So everyone has put the right answer. It is the vertebra from 2 to 6, right? So we have two types of movement. You all know clearly. Like one is the pump handle movement, other one is the bucket handle movement. Pump handle movement is a movement which was done increases the anterior posterior diameter of the chest, where the sternum moves upwards and downwards, increases the anterior posterior diameter of the chest, whereas the bucket handle movement increases the transverse diameter of the chest, where the ribs are started walking here. Both the movements are necessary to produce a normal inspiratory and expiratory movements. So the correct answer for this question is 2 to 6 ribs. Right. We are moving into the next question. When the person bends the elbow, the biceps contract and triceps work as. So what happens with triceps? When I try to bend my elbow, my biceps will contract. What happens to the triceps? So what is action of triceps? Agonist, antagonist, synergist, or fixators? Agonist, antagonist, synergist, or fixators? Very good. Antagonist is the right answers, right? So what is antagonist? So antagonists are the muscles which lies opposite to the muscle of contraction. This muscle produces reciprocal relaxation because when I bend the elbow, the triceps has to be relaxed so that it allows free movements of the bicep. If the triceps are tightened or if the triceps are contracted, it doesn't allow a free movement and we are not able to produce a smooth movement. So main role of antagonist is to promote reciprocal relaxation. The antagonists are very important muscles to produce a smooth movement in the limbs. So without antagonists, there will be no smooth movement possible. Right. This is one of the derived question, right? What is the name of the derived question? What is the name of this derived questions? There was Salman Khan is standing. More or less, it is you don't find the appropriate derived question is more or less same. That's like which is given in your textbook. Yes, any guess, fast, make it fast. Upstanding is not right. Step up. Okay. Sitting. Oh, it is not sitting, man. Person is standing. Just try standing. Varieties of standing. Step up. It's okay. Half answer is correct. It's not half standing, half kneeling. Okay, this is called a step standing. This position is usually used for abdominal surgeries. When the patient have abdominal surgeries, this position tries to relax the abdomen, and this is a common position used in the abdominal surgeries to relax the abdomen. Right? Step standing. Right, we are moving into the question number 5. Momentum depends upon two factors. One is the mass of the body, and other one is what? So momentum depends on two factors: mass of the body, its velocity at which it is traveling, inertial movement, force produced when moving, or change in the direction of motion. The velocity at which it is traveling, inertial movement, force produced during movement, or a change in direction. Excellent. Everyone has put the correct answer. The right answer is A only. Velocity at which it is traveling. Excellent answers. Happy to see all the answers given by you are very good. Next question. When the center of gravity falls easily out of the base of support is called a stable equilibrium, unstable equilibrium, neutral equilibrium, unstable base. And the center of gravity falls easily out of the base of support is called as stable, unstable, neutral, or unstable base. The unstable base is not the right answer. Okay, very good. Everyone has put the correct answer. It is unstable equilibrium. What is unstable equilibrium? Best example is toe standing, right? When the patient is toe standing, when you apply a slight movement, patient was unable to maintain the balance. Whereas when the patient is standing, when you apply it, when you apply little more force, then patient tend to move it, right? So the funnel is the best example. When the funnel is kept on the sharp corner, and when you apply light force, the funnel will fall. Whereas in neutral equilibrium, the funnel lies down, or the lying position is the neutral equilibrium where they have a larger base of support and the center of gravity falls in the base of support. There is no change in the base of support. So we move on to the next question. Basic starting position includes all except standing, sitting, walking, or hanging, which is not the basic starting position. Which is not the basic starting position. It's not the hanging. Hanging is the basic starting position. Okay. So basic starting position includes all except walking. There are 5 basic starting positions: standing, sitting, hanging, lying, and half kneeling. So all these are the 5 kneeling. All these are the 5 starting positions. So walking is not the starting positions. From this only the derived positions are there. The derived positions which help us to start doing exercises. That is one of the advantage of derived positions. Although that's what I have put lot of photos here today. I think 7 or 8 photos are there on the derived positions. Derived positions are the positions which are derived from the normal starting positions. Like if it is a lying, then we have lot of derived positions like supine lying, side lying, half lying. Sitting also same as half sitting. Last we saw as a standing position, right? Step standing. So same as we have lot of derived positions, right? So these are there are 5 basic starting positions: sitting, standing, hanging, kneeling, and lying. These are the 5 basic starting positions. Right. So in the levers, human body, which order lever are numerously found? Is it first order lever, second order lever, third order lever, or fourth order? Fourth order is not the lever. I just want to fill up the answer. Which order lever is commonly found in the human body? Is it first order, second order, third order? Only 3. The fourth answer is just like that. A is not the right answer. C is also not the right answer. B is not also the right answer. The right answer is C only. This third order lever only found numerously in our body. Although the effort is more, but our body will ready to put effort, but the function has to be moved on. So what is third order lever? Third order lever is the fulcrum is on the corner
Good.
of the body. Hello, sir.
Sorry, sir. Rupesh, you can remove the participant.
Okay.
Yes, sir. Please continue.
I thought you are telling something. Sorry. The third pass lever is FEW, right? The fulcrum, effort, and the weight. So weight is at the one corner, fulcrum is at the other corner, and the effort is on the middle. So we please remember it as FEW. Few. Few is the third order lever. And how to remember first order lever? In the few, F is the first nutter. So this comes in the center. So in the first order lever, fulcrum is the center, whereas effort and weight are in the other corners. And second order lever, we have weight in the center and fulcrum and effort on the other corners, right? So although biomechanically second order lever put lot of reduced effort and then put more weight, we can carry more weight. But as the human body, the effort can be produced more. So we are using our human body was designed to use third order lever. Right? What is the Sachin doing? Don't tell that he is assessing the pitch. This photo is also not appropriate photo. Still, you can find out some good derived question. It's not half kneeling. It's not half kneeling. It's not kneel down. It's not half kneeling.
Yes, sir. Yes, sir. But taking support and they are getting up like that.
No.
Okay, sir.
So it's like a bunny jumping. So what is the position we do before jumping? Bunny jumps, rabbit, the frog jumps. What is the position of the frog jump? Oh, sitting on. What is the position of the frog jump? Like kids will play, right? So before jumping, they'll have some position. Scout sitting. Scout sitting question. Right, we'll move on to the ninth question. postural tone is maintained and regulated by the reflex mechanism, which is myotatic reflex, polysynaptic reflex, vasomotor reflex, withdrawal reflex. Postural tone is maintained and regulated by myotatic or polysynaptic or withdrawal or vasomotor. Answer C is not the right answer. Yes, myotatic reflex is the right answer. I have given 3-4 questions related to the same reflexes in the question papers. Please remember this question so that you are able to answer that right. So myotatic reflex is the right answer, which helps to maintain the posture and maintains our body in erect positions. Reflexes from the muscle. Right. So next class we have postures. I'll ask so many questions related to postures in the next class. Okay, question number 10. Position of the patient is in order to achieve relaxation, freedom of thoracic and abdominal movement is which position make you relax and the freedom from the abdominal and thoracic movement? Is it supine lying, prone lying, side lying, or long sitting? Supine lying, prone lying, side lying, or long sitting? It's not prone lying. Because prone lying, your abdomen gets compressed, so you are not. It's not free. Which position relaxes thoracic as well as abdomen? So it is not prone lying, it is not long sitting, it is not supine lying, and the right answer is side lying, because when the patient lies on the side, his abdomen, thoracic was with the ground, and there was no movement occurs in the abdomen. Whereas in supine lying, the abdomen has to work effortlessly so that to produce a normal breathing. So abdominal work is more in supine lying. Whereas in prone lying, there is a compression occurs in the thoracic part and abdominal part. So there is a increased activity of the abdomen. So the right answer is supine lying. Okay, law of inertia is also known as very easy question. Right? Everyone can make it a 6. Law of inertia is also known as Newton's first law, second law, third law. Fourth, there is no fourth law. Everyone has put the right answer, which is first law, Newton's first law. First law is the right answer. And what is first law? When the particle an object is at rest and will remain rest unless some force acting upon it, and the object will travel motion at a continuous speed until it was acted by an unbalanced force. So when the object is at rest, it will be rest until a force acting on. And the third law, everyone you know, every action there is equal and opposite reaction. So kindly remember all these Newton's law, which is the basic physics for our. Right, question number 12. Capacity of a body to do work as a result of stored energy is called as capacity of a body to do work as a result of stored energy is called as potential energy, kinetic energy, work or light energy. So potential energy, kinetic energy, work or light energy. So body energy is stored. So that is key point here. Stored energy is potential energy, right? So when energy was stored, it is called as potential energy. Right. Tala Dhoni returns. What is this third question? Very good. Everyone has put the right answer because of Dhoni. Everyone has put the right answer. It is half meal. Right. So this is the question called as half meal. Right. So question number 13. Contractions are possible when the patient wearing plasters or fixation spring. Which contractions are possible? Sir, isoinertial, isotonic concentric contraction, static contraction, or isotonic eccentric contractions? I can see there is no wrong answers in this question. Everything is right answer. Very easy question. Right, contractions are possible is static contraction, because when there is a fixation or there is a plaster occurs, we can advise the patient to do only the isometric contractions. Okay, without isometric, I just put static. We usually call it as a isometric contractions, right? So why the isometric contractions? Isometric contractions has to be done to prevent muscle wasting. So when we advise the patient to do a lot of isometric contractions, because if the plaster was kept for 4 weeks, 6 weeks, 8 weeks, the muscle will start degeneration. The muscle will start degradation. The muscle starts wasting. Or muscle starts atrophy. So to prevent that muscle atrophy, we have to initiate isometric contractions. Right? And I think everyone knows that isometric contractions are the contractions without any producing any movements in the joints. Right, we'll move on to the question number 14. Which is the most comfortable, natural, and stable starting position? Comfortable, natural, stable starting position. Excellent. Everyone knows that it is lying. But here I am not giving you supine lying. You have to find out amount. Is it standing, sitting, hanging, or kneeling? Which is the most comfortable, natural, stable starting position? Standing, sitting, kneeling, half, hanging. As it was mentioned as comfortable and the natural and stable starting position, because since standing is not comfortable and stable, so here the best answer is sitting. Next, first one is the lying is the best position. The second one is sitting, because half of the body was rested and the patient was able to sit stable, so uncomfortable, right? So that's why sitting is the most comfortable position. This for this question. Okay, about all the statement about synergists are to accept, right? You know what is synergist, right? They operate from unconscious level, brings action of agonist stronger, contracts to prevent additional movement, relaxes opposite muscle to smooth or allow contractions. So far, wrong answers for me. I'm sorry to say that. Synergist, please remember what is synergist and type it. So they operate unconsciously, brings action of agonist stronger, contract to prevent additional movement, relaxes opposite muscle to allow smooth contractions. Wow, so far all the answers are wrong only. Very shocking for me. Because the same answer I have told previously to question back when we asked about the what discussed about the agonist, right?
In YouTube, it is C and D mostly, sir.
D is the right answer. Okay. So D is the right answer. It doesn't relaxes the opposite muscle because the opposite muscle relaxes by the antagonist. Synergists are the muscles which supports the agonist. Right? So they operate from unconscious level, brings action of agonist stronger. When the biceps act, the synergist brachialis also act along with the biceps to produce strong contractions. Right? It is not a tricep which relaxes for smooth contractions. And fixators are the muscle which fixes the joint and prevent abdominal movement. Right? This was discussed before, but still everyone has put the wrong answers. Okay, very tricky questions. So in my class also they have asked. I was not able to give a right answers for that. But how many passive movements are needed to prevent adhesion formation? Is it 2 movements, 10 movements, 15 movements, or 30 movements? How many passive movements has to be given to prevent adhesion formations? So my teacher also has taken a wrong answer only. After studying the exercise therapy or after I started taking the classes, I was able to identify that my teacher also told the wrong only. I was sorry to say that. Because when I found this answer in the textbook, I was really surprised. Oh, this is
Sir, even when I was doing my post-graduation, I was asking, I asked my professor that how many movements are sufficient? And I said a number and said, if I do it one less, is it insufficient? Or if I do it one more, is it overdosage? So it's really a very tricky question, sir.
What Dina Garner says is very surprising. He said it is 2 movements is enough.
Yes, sir.
Just 2 movements is enough. I'm not saying it's, you can ask Dina Garner, the old lady who writes about the principles of exercise therapy, right? Same as she also told that passive movements, we can give only 2 movements to prevent the muscle wasting. But
2 movements per day. That too.
Yes, per day. That's it. What my teacher said, you have to give 90 contractions, 90 movements. 30, 30, 30. You have to do.
Yes. So, thank you, sir.
It was really surprise.
Yes, sir. Yes, sir.
Okay. So anyone has query in this, please refer your Dina Gardner textbook, line by line, find out where this answer is. So basically, it is in the passive movement chapter. Okay, what is this derived question? Okay, this is also not more or less our derived question which is found in the textbook, but what is this derived question? It's Nama's question. Yes, any guess? Ah, very good. Archana Yadav, Tanya has put the right answers. It is an inclined prone kneeling. Right? So still the patient can, the person can bring the arm a little more, and that is inclined prone kneeling. Very good. It is the correct answer. Inclined prone kneeling is the right answer. Okay. So very easy question. Patient hikes the pelvis on one side, thereby appropriating the pelvic rim to the inferior portion of the rib cage. This is to test which muscle? Obliques internus, latissimus dorsi, quadratus lumborum, oblique externus. So when the patient hikes the pelvis on one side, thereby appropriating the pelvic rim to the inferior margin of the rib cage. So we can lift to the rib cage. Which muscle we are going to test here? Manual muscle test. Everyone has the right answer. It is the quadratus lumborum. So what is the action of quadratus lumborum? Quadratus lumborum, you see that it starts from the iliac crest and inserted in the 12th rib, right? So it is the picture here. It starts from the iliac crest and inserted in the 12th rib, whereas it is also attaches to the transverse process of the lumbar spine. Bilaterally, the quadratus lumborum contracts and produces the spinal extension. Unilateral contraction of the quadratus lumborum, or if the spine is fixed, only the quadratus lumborum acts. It is called as the hip hiking movement. This is also called as hip hiker muscle. Right, we'll move on to the question number 18. Motion occurs when an object describes a circle or arc of movement about a fixed point is called as linear, curvilinear, angular, curvangular. Movement occurs on an object with a circle or arc of motion about a fixed axis is called as linear, curvilinear, angular, curvangular. There's no curvangular. I just put, fill the gap. I just put. C is the right answer. It is called as angular movement, right? So when there is a movement occurs and it occurs in a circular movement, it is called as angular movement, right? You can see in the shoulder joint in circumflexions, or when the person swings the body, like trunk swinging is also the angular movement. Right, question number 19, while keeping restful atmosphere in the room during relaxation exercises, which color should be avoided? Indigo, bright red, sea blue, baby pink. Relaxation technique, right? So which color you should avoid? Bright red should be avoided, right answers. Right? So we should not put a bright red, and we cannot make the patient to relax it. As you can see, the best color chosen by the textbook was indigo. Right, increase in the velocity of moving body is called as momentum, positive inertia, positive acceleration, negative acceleration. Increase in the velocity of a body, moving body is called as momentum, positive inertia, positive acceleration, or negative acceleration. Positive acceleration is the right answer. Right. So increase in the velocity of moving body is called as positive acceleration. Decrease is called as negative acceleration. Right, what is the name of the derived question? So this is also not same as the appropriate derived question, but more or less same. Yes, very good. Everyone has put a right answer. It is long setting. Long setting is the starting question for hamstring stretchings or lower lumbar spine stretchings, right? So when you adapt a patient, or you are supposed to find out how much hamstring tightness also can make the patient in a long sitting and then do it. Sometimes long sitting also advised for the patient to increase breathing exercises, to give a good breathing training. Long sitting is also advised. Long sitting is one of the best portion we use in the physiotherapy practices. Contraction of the muscle from full stretch to the muscle to the midpoint of the full range is called as contraction of the muscle from fully stretched position to the midpoint of full range is called as outer range. Inner range, mid range, or full range. From fully stretched to the midpoint of full range. Fully stretched to the midpoint of full range is called as outer range, inner range, mid range, or full range. The answer is not C. It is not mid range. So the answer correct is the A is the right answer. It is outer range because it is from fully stretched to the midpoint. From midpoint to the midpoint is called as mid range. From fully contracted to the midpoint is called as inner range. From fully contracted to the fully stretched is the outer range, right? So why we are supposed to note down these ranges are sometimes when you give exercises, when you teach exercises, we are supposed to focus on these ranges. Sometimes you can give only patient exercises on the outer range. Sometimes you have to give exercises for the inner range only. So we have to understand what is the normal range of muscles. Although there is no normal degrees like range of motion, we have 10 degrees for mid range, 20 degrees, 30 degrees, that is not given here. But every patient has a mid range, outer range, and every muscle has got mid range, outer range, inner range, right? You have to find out and you have to start teaching the exercises, depends on the patient need. Right, question number 22. When the arm is raised from sidewards, right? When you ask the patient to do sideward abductions, the abductor of the shoulder contracts is called as very easy isometric contraction, isotonic contraction, isolytic contractions, or isotonic lengthening. See, isometric contraction, isotonic shortening, isolytic or isotonic lengthening. Everyone has put the correct answer. It is isotonic shortening is the right answer. Isotonic shortening is the right answer. It is also called as concentric contraction, right? When you abduct the shoulder, the abductors work the shoulder to put the shoulder in the higher or doing abduction. So abductor produces a concentric contraction. That is the movement of the muscle comes towards the center is called as concentric contractions. Whereas eccentric contraction of the contraction where the movement moves away from the center is called as eccentric contractions, right? So the concentric and eccentric contractions are the part of the isotonic contractions. These usually we always teach the earlier phase of rehabilitation, isometric contractions are done, whereas in the later phase of rehabilitation, we always go for isotonic contractions, right? So one of the disadvantages of eccentric contractions is that eccentric contractions, when you do lot of times, it results in DOMS, delayed onset muscle soreness. So when we prescribe exercises for eccentric contractions, we have to add little stretching to the muscle so that prevents delayed onset muscle soreness, right? Okay, 23. One of the dangers of prolonged bouts of coughing is. So when you ask the patient to cough, or prolonged coughing causes, what is the danger? Is it fall on cardiac output, fall in the respiratory rate, fall in the body temperatures, or fall in the pulse rate? So one of the dangers of prolonged bouts of coughing. What is the dangers? Respiratory rate, body temperature, pulse rate, or cardiac output? I don't know why everyone chooses B. Right, yes, B is not the correct answer. Jagadish has catch the point. I think A, right? A is the correct answer. Because when you do the prolonged coughing, there was a fall of cardiac output, which is also a danger for the patient. Sudden fall of cardiac output may result in cardiac arrhythmias. So we have to stop the patient doing excessive coughing, especially post-surgical coughing and all has to be taken care immediately. Cardiac surgery, post-surgical coughing. Okay, question number 24. When the patient lifts the arm into extension and adduction in prone lying to test which muscle? Patient lifts the arm into extension and adduction in prone lying is to test which muscle? Rhomboids major, teres major, latissimus dorsi, levator scapulae. Rhomboids major, teres major, levator scapulae, or latissimus dorsi. So make the patient in prone lying. Ask the patient to do abduction, adduction, and extension. So which muscle we are going to test here? Adduction, extension is done by which muscle? That's what we are going to test. Everyone says latissimus dorsi, so I am also accepting that it is latissimus dorsi. transverse dorsal testing, make the patient in a prone lying position, ask the patient to do extension along with adduction against the system. If the patient was able to do that, then the patient doesn't have, the patient range is 3, or muscle core is 3. Then we can add resistance, and we can add more resistance to find the 4. Move on to the next question. Oh, Ricky pointing, right? What is the name of the derived question? This is also not the appropriate derived question, somewhat okay. Right? Then prone lying. Prone falling is the correct answer, right? The right answer is prone falling. Although in prone falling position, the leg has to be in the ground, and as the arm is also has to be in the ground. But here I don't find a picture, so I just put somewhat near picture is the Ricky pointing. I'm interested much in sports therapy, so I just put a lot of pictures on the sports. Okay, rate of doing work is called as power, endurance, force, or work. Next question is rate of doing work is called as very easy power. Everyone has put the right answers. It is power. Rate of doing work is the power. Everyone has put the right answers. Right. In standing, arms are straight and elevate sideways to a horizontal position. Right. So this is one of the questions related to the derived question. In standing, arms are straight and elevate sideways to the horizontal position. What is it called as? Yard standing, reach standing, stretch standing, walk standing. It's A, B, C. Yard standing, reach standing, stretch standing, walk standing. It's not yard standing. It's not yard standing. So why you have to use yard standing? Right, it is called as the it is yard standing only. So this is yard standing, right? So the patient, right, and the patient tries to do a horizontal extension. This is yard standing. Sorry, I forgot. I think it is a stretch standing. Okay, we'll move on to the question number 27. During control lowering of the weight in the biceps curls. During control lowering of the weight in the biceps curls, the biceps undergo what type of contraction? During control lowering of the weight in the biceps curl, the biceps undergoes what type of contraction? Is it isometric, isolytic, isotonic shortening, isotonic lengthening? What type of contraction you can found when the patient does a controlled. So isotonic lengthening is not the correct answer. Please try some different other answers. It's not see how it is. It is not shortening, right? It is lengthening only, but it is not isotonic lengthening. So this B is the correct answer. Isolytic contractions. What is isolytic contractions? Normally, it is not the normal muscle contractions like isometric or isotonic. Whereas isolytic contractions are the contractions which the muscle will contract when the external force is acting against it. So when the external force like a weight, when the patient is bringing down, the muscle contracts to prevent excessive movement. That is called as isolytic contractions. Although it is not the normal muscle contractions like isometric or isotonic. So this is the muscle contraction which happens to prevent excessive loads. Right, brachioradialis muscle act as a flexor in the forearm is example for which order lever? First order, second order, third order. Brachioradialis. Which order lever? First order, second order, third order. Right, very good. Everyone has got the correct answer. It is second order lever, right? Brachioradialis act as a second order lever. So what is second order lever? The effort weight is between the effort arm and the fulcrum, right? So here in the second order lever, the fulcrum is the elbow joint. Effort is the weight is at the forearm. The forearm is the weight, and the brachioradialis muscle effort is on the effort arm, right? So the brachioradialis inserted in the lower end of radius, that is on the styloid process. The muscle pulls the elbow, this muscle pulls the elbow to the flexion, where it pulls the heavy weight of the forearm. Right? So the fulcrum is on the corner and the weight is at the center. Effort is on the other corner. So weight is at the center. Is central weight here is mentioned as the forearm bone and the muscles, and the brachioradialis muscle act as a effort. So it produces lot of effort to bring the elbow in the flexion. It is the example for second order. Biceps is the example for first order. Capacity of the muscle to contract muscle at a specific rate of specific interval is capacity of the muscle to contract a muscle at a specific rate of a specific interval is muscle repeated contractions. What is the repeated contraction of the muscle? Is it power, force, work, or endurance? It's endurance, right? Everyone has got the correct answer. What is endurance? When low repetition, high repetition, low resistance, right? When the training is given with a high number of repetition with a low resistance improves endurance. Whereas how the power improves when the contractions are given high resistance with low repetitions improves the power, whereas the low resistance, high repetition improves the muscle endurance. Both the muscle power and muscle endurance are necessary to produce a muscle contractions, right? So for normal activity, both these are equally important, the power as well as endurance. Right? So mostly we'll read that the power is anaerobic and endurance are aerobic, right? So both are also right. Right. So the last question for today's session, right? Little longer, but please think and answer. This is also a part of derived questions only. One leg is placed forward to a distance of 3 feet and the knee is bent. First, the right leg is keeping forward and bend the knee. And the left leg remains straight and the body is inclined forward in a line with it. So the right leg is keeping forward to a distance of 3 feet and the bend the knee. The left leg is back straight and it is the body is inclined forward. What is this position called as? Lag stoop standing, lunge sideways, stoop standing, forward standing. Is it lag stoop standing, lunge sideways, stoop standing, or forward standing? Henshaw came up with the right answer. Yoshita, correct answer. Excellent. Let's think about it, how they are positioned. Think about that and then answer. Yoshita, correct answer. Agansa, correct answer. Very good. So the right answer for this question is fall outstanding. What is fall outstanding? This is a position, right? The front leg is 3 feet longer and the patient was flexing the feet, whereas the back leg is extension and the body is trunk is inclined forward. Okay. This is called as the fall outstanding. Okay, usually we always do a step standing for doing movements like massage or passive movements. We always do a step standing. Right, we are going to finish up with the last picture. What is the name of the derived question? Say it is Rajinikanth standing. Yes. Wing standing Tanya is half right. Tanya is half right. And the right answer is low wing stand. It's a low wing stand. So when the patient keeps the hand on the hip is called as wing standing, whereas when the patient keeps little down to the hip, it is called as low wing standing, right? So here comes the end of the session. You can find some more MCQs in my textbook. So that's all for today's session. I think the 30 questions along with 10, I think 5-6 papers will be helpful for you. We'll have
Yes,
next
correct.
session part of exercise therapy 2, right? I'm planning to take probably the next June month we will cover only exercise therapy, right? Because exercise therapy is like a ocean. When I start taking questions, I was able to get lot of questions. I was really find difficulty to curtail which questions we have to give, because there are so many questions I was able to pick up, but still I have trimmed it and make it as 30 questions for the class and 30 questions for the exams. So the next class we will have the suspension therapy class in moments. Anyways, I will send this in the WhatsApp group. So we will meet you on 2nd June.
Yes, thank you, sir. Thank you for wonderful questions. Especially, there were 50 concurrent viewers watching us in YouTube, and we are having 25 plus here in Zoom. And they might have learned that 2 movements are enough. That was a wonderful message. For whole day, 2 movements of passive movements is enough, because when we are going to what, they may not do 30 times, 60 times, or 90 times like that. Morning one session and evening one session. So all those efforts are wasted. 2 movements are enough. And another question is about isolytic, that is eccentric contraction with the weight. So that many of them may not know that isolytic, and even the last one, low wing standing position. I even enjoyed, sir. Every question is very beautiful, but they will remember all these questions in a way when they come to practice.
I think
You, sir.
they'll also start looking like me in the pictures or the movies when they go. Like, what is the question we standing? What is the question they start?
Yes, sir. Yes, sir. Yes, sir. So you are giving the visual treat, sir, actually. So they will, next time when they see Kala movie or whatever, Rajinikanth movie, if he stands like that, they will remember that low wing standing, not Rajinikanth.
They start forgetting their stories and then they start thinking about physiotherapy.
Yes, sir. Yes, sir. See, somebody is responding here, Jagdish. Yes, sir. Those 3 questions are very new, and yes, there are so much of appreciation, sir. And even here in YouTube also, there are a lot of appreciation message and thanking messages, sir. Thank you for the wonderful session. Thank you, dear participants. Thank you, Dr. Rupesh, for helping me to connect with YouTube today.